very excited to be here with you and cruise into lunch together here as discussing the exciting world of digital impressioning. And while we get this thing set up here real quickly, there's one other video that I'll ask you to start real quick. Is anybody currently using a digital scanner in lieu of an alginate or a traditional impression and sending files to the laboratory of their choice? Anyone here at all? Great. So this is an exciting, growing trend, and that's what I hope to cover with you today, and hope to show you the scanner. We have it ready to go. I travel with it, as Jim mentioned, all over the northern United States, basically, and it's always with me. I can plug it in at any time as long as I have any type of USB connection, and I'm ready to go live at any time. So it's very exciting. I've gotten kind of unlike Jim, I don't know if I'm a lifer, but I'm definitely a closet dentist. I've spent about 22 years myself in dentistry with other types of equipment, some laser stuff, different things. This is a very exciting area, and I'm happy to be here. So if we can start this video real quick.
Many obstacles keep your work from flowing. Welcome to the new reality. In the new reality, the CS3500 intraoral scanner provides everything you need for the perfect restoration, and nothing you don't. With no conventional impressions, anti-reflective powder or conventional impression material required, it allows you to create highly accurate 3D models of teeth with greater patient comfort. Ergonomic and compact with a slim scanner head, the CS3500 offers a streamlined workflow that both you and your patients will appreciate. Unlike other 3D intraoral scanners, the truly portable CS3500 doesn't need a trolley to move around your practice. It can be easily shared and connects to any PC workstation via a USB cable. But perhaps the most convenient innovation of all is the scanner's light guidance system. It guides you through the image acquisition process and allows you to keep more of your focus on your patient by minimizing the need to monitor your screen during scanning. You can scan to a depth ranging from -2 to 13 millimeters and within a 45-degree angle to the tooth surface. A capture selection button allows you to select your acquisition, upper jaw, lower jaw, or bite registration right from the scanner. Or if you prefer, you can scan existing stone models, digitalizing them to save storage space. During digital acquisition, the scanner's built-in heater streamlines scanning by preventing mirror fogging. It also features a sleep mode, which turns off the LEDs after a period of non-use to save energy. The actual tips come in 2 sizes, the smaller of which is ideal for children and adults with smaller mouths. Each tip can be autoclaved and is disposable for proper hygiene and infection control. Once scanning is complete, high-resolution results are displayed almost immediately. True color 2D and 3D images help you clearly distinguish tooth structures from soft tissue and restorations. And with an average precision of 30 microns, you can quickly and accurately identify the margin lines, contact points, and undercuts necessary to design well-suited restorations for your patients. Crown design is simple, with clear instructions and intuitive steps. Plus, when paired with our CS3000 milling machine, you can go from scanning to milling in just a few clicks. However, if you prefer, impressions or restoration designs can be sent to the lab via CS Connect, an efficient online connection between you and the lab. These solutions are part of an open system and are compatible with other CAD/CAM systems. Together, they make up our innovative CS Solutions portfolio. In the new reality, you just focus on the work, and we'll make the work flow.
Okay, so that's a basic overview of the different options that this scanner will allow you to have, and we'll cover that real briefly and then hopefully address any questions you may have. We'd be very happy to do that as well. So how do we play these? There's a little, just click at the bottom, there's a little, just real briefly, I like to start my lecture. This is my grandma, she's a little nutty, but she really enjoys living. And I wanted to share this with you if we can get it to play. At the bottom there's a little play.
Oh, right there.
Usually.
The monitor might be low.
Okay, we may not be able to share my grandma.
You gotta show that. Your grandma's nutty. We gotta see that.
Yeah, just
Oh, it is?
start from the beginning.
Okay. If it's saved as a picture, that's not good. So let's just skip a little, just give me, yeah, to go to the, sorry about that. On my laptop, if you feel like it, it's a very short video. She's funny. And this is my aunt. I don't see her too much, but she's actually even crazier. But, so the 3500 scanner, this is what we're talking about here. And for those of you that are familiar with some of the systems that have been out there over the years, i.e. CEREC, unlike Jim, I'm not afraid to mention my friends, i.e. competitors. The brand name, right, the Kleenex of scanning and of course CAD/CAM design. What makes us different and what I hope to impress upon you is that you don't have to be tied to a computer or to a cart, and you certainly don't have to design anything in your office. All you would be doing is replacing the traditional impressioning way of doing things with trays and materials and staff time with a scanner that can take the photographs that you need, and you can simply email that immediately to a lab of your choice. That's all. So these are the options that you have with the scanner. This is the new reality. Carestream, I mean, I think all of us here in this room would agree that technology has obviously changed what's possible in dentistry, and it's continuing to do that. However, sometimes it is a little too complex, isn't it? Sometimes it's a little too much for you guys to really have the time, have the energy to really delve into everything that it can do. We are literally, without dumbing this down too much, have really simplified this process. It's a growing trend. I cannot tell you how many, we did a couple of labs yesterday just from traveling together over the phone. What I mean by that is labs in general now are accepting open STL files from you if you have the ability to send those to them. What a lot of labs don't necessarily have in place yet is a way to print a model or create a model, or necessarily some labs are actually doing model-less dentistry. It's all digital. They're graduating. But let's say you have a lab that will, yes, sure, we take an STL file. You send them the file, they may in turn forward that to a milling house somewhere in the United States that will produce the model and get it back to them, get a restoration back to them. They will characterize it and put some staining and glazing and so on based on your instructions and on your case, and send you the final product. So that's kind of the flow of things currently. Okay, so I won't get too much into the return on investment. What I encourage every one of you guys to do is if you don't know what your impression material is costing you, let's say monthly, how many impressions you take, trays, so on, maybe do a small analysis of that on your own, because what you'll realize is that it's not maybe as cheap as you thought as it was. And in many cases, we are literally swapping out the cost of what you would spend on that with a scanner, and of course, improving time and communication between you and the lab. And unlike traditional impressions, STL files do not change due to time or temperature or anything, and is saved in your patient's record that you currently are using in your practice. So think about that for a moment. The digital impression, once again, it's more comfortable. The accuracy factor, you're going to hear more and more about this because there are more and more science coming out backing this way of doing things. Labs are actually very excited that they're not going to get a bag from you with 5 impressions in it, you know, each one being dedicated to a different part of the, you know, can you use this one for the mesial, this one, you know, if you're the lab, think about that. How accurate is that really going to be? What is the standard for accuracy? These digital scanners have completely turned that on its head. So you can count on having very, very accurate impressions. We're splitting hairs, literally. A 25 micron scan compared to a human hair, which is 70 to 90 microns, you're talking about considerable difference. This is, again, you know all about this. Take a look and see what it's costing you monthly. It all starts with the scan, however, right? And this, I'll be happy to, this is my scanner. Like I said, I travel with it everywhere. I'm not tied to anything. I have a USB connection. I'm ready to go. So if you have multiple practices, you travel, or just in between operatories, you can imagine the freedom And sometimes while your patient is in the chair, let's say you're doing a crown on 30, you scan obviously the prep, the adjacent teeth, you want to get the antagonist, the opposing, and the quick bite shot. It takes 1 or 2 shots. Send that file off. In many cases, while your patient is still there, if there needs to be any correction, your lab will actually get back to you and tell you that. So it's very, very efficient. No shipping, costs, no time, very quickly. These are the things that we've addressed. Powder-free scanning. This is huge for those of you who have had any experience with, especially if you're in ortho working with kids, to powder an entire mouth and to keep that dry, it's just not realistic. Fast scan times, intuitive manipulation, it's got to be easy to use, there's no question about that. Good contacts, high resolution, these are all the things that we've addressed with this scanner, and I'll get into that a little bit more here shortly. Again, these are some of my friends that I mentioned earlier. That's them. This is me, not to beat a dead horse. This is it. Your existing computers, whatever you have in your practice, I come in, I plug into it, and I am within your network. Your patient database. You open up Mrs. Jones, you click on the scanner in the imaging software, and I'm ready to go. With this, I am re-entering. It's a redundant database. The patient information is totally separate than what you have. You send the file, it may go to Costa Rica or Israel or wherever for 24, 48 hours before somebody does something with it. These are all things that are associated with these types of systems. Sir?
You are Mac friendly?
Mac friendly?
Mac.
No, we're not Mac friendly. Not yet.
So
I have to bite my...
If that's the system you have in your office, you need to...
Yes, I have to bite my tongue. In your case, you have to...
Get a separate laptop.
Yeah, get a laptop or do something separate. But I have to bite my tongue on the Mac because it's very close, but I can't talk to you about it.
Right.
Yes?
Can you make 2 crowns or more than 1 crown on multiple at a time, or it has to be 1 at a time?
It would be 1 at a time for now. At the end of Q3, which is the end of September, the software update. We've already, in the short year and a half, we've had 3 or 4 updates to our software, and that's one of the things I was going to impress upon you as well. Once you buy this hardware, you are done with costs. Some of the other, I like to stay positive, some of the other features of my friends up here are fees, ongoing fees.
Only the first year they included.
Not only the, yeah, exactly, only the first year, or it's per scan. You know, every time you click to convert the file to STL, it's $50 to you. The lab doesn't like it because they charge $50 every time they open the file. You're right, and they usually pass the cost on to you. Or some scanners like this one, they'll just say to you, Doc, don't worry about it, it's not per case, we'll just charge you $4 grand a year, that's all. And it's unlimited. How many cases do you want to do? Feel free. $0 monthly, 0 per case, 0 everything, that's it. Carestream, we wanted you to have the ability to own the hardware. The software, as far as updates, will be ongoing, $0 to you, and it doesn't cost you anything to send it to the lab, and the reason labs love us is because they don't have a fee. There's no conversion. This is a natural STL, stereo lithography file that anyone could open that wants to open it, as far as the lab goes.
Does it work on Invisalign?
No, not Invisalign yet. It's in the process right now, and that's why I said if they want to. Invisalign, we love them, right? They're in the business of selling aligners. They will be the first to tell you. I met with them at the AAO. They love our scanner. They don't love the fact that we're starting to sell too many of them because they have an interest in iTero. They have to, not lose money. Any business would look at that. Okay, so they're not in a hurry to say yes, we'll take Carestream files. They could right now, today, take our files. So therefore, other companies like ClearCorrect and other companies are already on board with us because again, we have absolutely no limitation to our files.
What's the cost?
We'll